We've got this gentleman and this gentleman.
Guy Herman is sorting through some of the many mental health case files he's reviewed and ruled on as a probate judge for Travis County. He'll be the first to tell you we have a mental health crisis in our community, and he's been fighting for better services during his more than 35 years as a judge.
And I saw what I would call at that time in 1980 the sorry state of affairs that we had for taking care of mentally ill persons. They were either put in a jail or they were put in the Austin State Hospital.
Herman says jail or the hospital are not the places to take a person having a psychiatric crisis. The new Judge Guy Herman Center for Mental Health Crisis Care, named in honor of Judge Herman's commitment to proper care and treatment, will be a major step in that direction.
One of the first areas we knew that we had a crisis in is we did not have a mental health crisis stabilization center. And that's what this Herman Center is going to bring to the community, the first ever of its kind.
We'll have a place that will be able to stabilize the condition, do further assessment on the level of care that the person will need on an ongoing basis.
The center will be built on property owned by Central Health on Montopolis Drive in southeast Austin and operated by Austin Travis County Integral Care.
Central Health leased the land to Austin Travis County Integral Care for the princely sum of $1 a year. It's an outcome of the promise that we made to the community to provide this leadership to the community in terms of making improvements to behavioral health services for our residents.
St. David's Foundation led the charge to fund the new center.
St. David's Foundation invested $8.9 million in the center, and other stakeholders pulled out their checkbooks, and we leveraged that $8.9 million to the point that the center is fully funded, and we're ready to get construction started, and it'll be operating before you know it.
So Integral Care will actually be the operating agency. So we'll be staffed with psychiatrists, specialized nursing, that will do the assessments, that will help create the environment of care to stabilize the crisis.
Austin Police, like Lieutenant Brian Jones, welcome the new Herman Center. Lieutenant Jones heads the police department's crisis intervention team, which responds to emergency calls related to mental health.
The more options that are available, the better outcome there is going to be, not only for the person experiencing the crisis, but for the community at large. Because if they're receiving care without being incarcerated or hospitalized, they can remain in the community and actually be put on a path to recovery.
Valerie Dodd Milburn has been on the path to recovery from bipolar disorder. Now a fierce advocate for better mental health care, she lost a career to her illness and struggled to find appropriate care for many years.
I know several times I ended up in the emergency room, and that was not a safe, secure environment. I think the Herman Center will be a place where people can go when they're in a psychiatric crisis to get safe, secure assessment and treatment.
And if you think about how widely prevalent these major mental illnesses are, and then to hear that there's a place that offers timely access, stabilization, good assessment as to what the right level of care will be, and to begin the treatment process, I think this also then will tell a reoccurring story of hope.
We're trying every way we can to divert people out of the system, keep the community safe, keep the person safe, and get the person back on track. This center will help do that.
And because of the stigma associated with mental health issues, we don't talk about it. But what's important to know is that treatment is necessary and recovery is possible. There is always hope, and I am a living example of that.